In the previous video, we talked about how the United States doesn't have a free market in healthcare, and alluded to why prices are so high. I spoke mostly about Medicare and Medicaid, and mentioned that over half of all healthcare dollars are actually managed and spent directly by the government. When people compare our system to a, quote, socialized system, what they're forgetting is that our system is greater than 50% socialized already. Here's a graph of the healthcare expenditures as a percentage of GDP. In 2011, greater than 18% of the total productivity of the United States was devoted to healthcare. In pure dollar terms, the numbers are even more dramatic, even adjusted for inflation. The United States government alone spends more per capita than any other government in the world on healthcare, and that only covers Medicare and Medicaid patients. With public and private insurers combined, we spend more per capita than any other country, and our per capita spending is 50% greater than the runner-up. We now have an idea of the scope. There are many other contributing factors for the rise in medical care. People are demanding more care due to poor lifestyle choices. The obesity rate is now 40%, for example. In addition, people have more disposable income than they used to have, and the quality of healthcare as well as availability is better. It makes sense that they would want to spend it on something to help their quality of life and attempt to live longer. In addition, the cost of dealing with medical malpractice has risen dramatically. Though these costs are still only a small part, there's also the matter of increased spending on tests due to doctors being more and more worried about getting sued, which is extremely difficult to quantify. Making things worse, trial lawyers donate more money to congressional elections than the entire healthcare industry, making reform in this area impossible. Further inflating costs is the fact that people are demanding more and more preventative medicine, which costs far more than it saves. In addition, the demand for elective procedures is rising as they become safer and doctors start recommending them more. That's not to mention the demand for expensive new prescription drugs, both by doctors and patients, which provide little benefit over cheaper existing medications, or are for conditions that are not medically vital. This is of course perfectly fine. However, in other industries, consumption usually rises as prices fall, often corresponding with less share of personal income being spent on that product. For instance, you can see from this graph that people have been eating more meat over time. However, over time, people have been spending less of their disposable income on food. In fact, take a look at this graph, which shows how many hours of work the average American will have to put in order to earn common consumer goods. Why is it that healthcare doesn't follow this trend? Quality may be rising, but costs are rising even faster. In this video, I'll talk about a problem that bears even greater responsibility than the elephants in the room run by Uncle Sam and all the aforementioned factors. This is something totally ignored by politicians, but most economists say it is central or even the most important reason costs are rising. Of course, I'm talking about third-party payer and why the government is to blame for the astronomical cost of medical care. Third-party payer refers to the practice of health insurance companies taking your money and using it to pay your medical bills for you. Insurance is supposed to pay for things that are unlikely to happen. Health insurance, by contrast, has come to mean reimbursement for just about anything health-related. On the face of it, this doesn't really make sense, but here's John Stossel's take on third-party payer.
Politicians promise more health insurance coverage.
And cover everyone.
They cover everyone.
Cover more people. What if you had grocery insurance? You wouldn't care what things cost. Why buy hamburger? I'll just buy steak. So why look for sales? I'll just buy everything. My insurance company's paying.
No one would want to purchase car insurance that pays for regular maintenance on your car, like oil changes and new tires. This adds a large transaction cost to everything bought and paid for using the service, but that's only a small part of it. Clearly, your insurance premiums would never add up to more than you could hope to get reimbursed for. Any insurance company that reimbursed more than it collected would go out of business. You would have to slice your tires every day on the way home from work and buy the best tires at the store to replace them with, just to get your money's worth. Unfortunately, people treat health insurance differently than any other insurance, but there is a reason for this. As ridiculous as it is to have a middleman on common things that everyone buys, like regular checkups and screening tests, there's an even bigger problem. Since you're paying a flat fee for all services and drugs you could ever want, there's no incentive to shop around or to use them in moderation. This allows incredibly inefficient institutions to exist in spite of their high prices, as well as inflated prices on drugs, hospital stays, and doctor visits. Here's Nobel Prize-winning economist Milton Friedman on the subject.
What's happened now is that we have an enormously inefficient system with tremendous waste.
with the most extraordinary administrative complexity you can imagine. That if I have a low deductible, I will be much less careful, much less careful
Sure. Yeah.
about how much I spend on medical care than if I have a high deductible.
It's clear that health insurance is a great thing to have in case of serious injury or illness, or a chronic or terminal disease that is expensive to treat. But having a middleman set up an all-you-can-spend health buffet is not something that makes financial sense. As with any common practice that doesn't make economic sense, the origins of this are squarely rooted in government policy. For decades, taxes have been rising on the wages of employed Americans. The average personal income tax rate on median family income was 7.4% in 1955 and had risen to 12.2% by 2010. On top of that, you add in Social Security as well as Medicare taxes, which were at 4% in 1955 and had risen to 13.3% by 2010. It should be noted also that the maximum taxable income of Social Security and Medicare taxes is rising as well. I only point out these taxes to make one observation. The total average American family's wages have increased in taxation from roughly 11% in 1955 to 25% today, and that's just on the federal level. At the same time, compensation by employers in the form of health insurance has been totally untaxed. Again, 11% taxes in 1955, 25% today, and all the while employer-provided health care insurance has been taxed at zero. The results of this tax policy are as one might expect, but before we get into that, how about a little history? Employer-provided health insurance is said to have arisen because of the wage and price controls of World War II. Employers wanted to pay their employees more, but FDR's misguided wartime technocrats were trying to micromanage the economy. Therefore, their only option was to find other ways of reimbursement besides wages. Health insurance as a form of reimbursement was taxed much less than other wages until 1954, when all remaining taxes on the practice were removed. It was only natural, therefore, that employers and employees follow the incentives into this arrangement. Between 1940 and 1960, the number of insured went up sevenfold. By 1965, a little less than 75% of the population had some form of health insurance, and that number was rising rapidly. However, even with this rapid rise in the insured, it was rare that anyone be insured for care not involving surgery or hospitalization. For patients seeking treatment in an outpatient doctor's office or wanting a yearly checkup, it was traditional to pay out of pocket. Medicare Part B, passed in 1965, helped change this trend, but the economic reasons for insurance companies to adopt this are obvious. Because of these government policies, health insurance has changed from actual insurance to a way of employers and employees to subvert the tax code. This leads to modern quote-unquote insurance, covering much more than insurance ever should. Regular checkups, preventative medicine, elective procedures, and chronic medications are all covered by the majority of today's plans. Now let's take a look at the rise of third-party payer and the fall of patients directly paying for their own medical care. In 1960, roughly 47% of all dollars spent on healthcare were paid out of pocket. By 2008, that number was down to 12%. The rest is paid for by government and private insurance companies. Take a look at the graph of healthcare versus GDP once again. These costs are rising far too astronomically to be accounted for by other factors. There is something fundamentally wrong with the incentive structure of this industry. Also, it seems to be inexplicably immune to recession, unlike other industries. This is the typical pattern of government intervention. Given that these things are true, what do you think the effect of Obama's 2010 healthcare reform will be when it is fully realized?
There's a lot of talk and arguing in the country right now about reforming healthcare. President Obama would have insurance companies cover more of our medical expenses and lower deductibles.
Essentially, the Patient Protection and Affordable Care Act of 2010, also known as Obamacare, will force the market to increase coverage and therefore increase costs. It is said by some economists that there is a critical mass for healthcare spending. If that's true, we're certainly moving in that direction a lot faster. The good news is there's a simple and elegant solution to solve this issue in an orderly and decisive way. The government could once again tax employer-provided health insurance. Alternatively, and in my opinion preferably, the government could abolish the income tax altogether. This would eliminate the incentive for employer-provided health care, and over time the practice would be eliminated. As this is happening, people will realize that high-deductible insurance is actually much cheaper. Removal of other government intervention could further lower costs, like state insurance regulations that reduce competition. It would also be beneficial to eliminate Medicare's discriminatory pricing policy, whereby if a doctor sees someone for free or less than they charge a Medicare patient in his or her office, they can be subject to a raid by the federal government, as well as fines and imprisonment. Essentially, the further government gets away from healthcare, the more affordable and accessible it will become. Unfortunately, the largest third-party payer is government. Though prices will come down dramatically if the government stops manipulating the private sector via the tax code, the problem of government being such a large payer will likely still remain. Obviously, raising copays and instituting a deductible into Medicare and Medicaid would help, but these solutions are so politically impossible, it gives one a headache to even contemplate. In fact, Americans are so addicted to Medicare that even the accusation of Medicare cuts is considered a devastating political attack. With elderly voters flocking to the candidate who promises to continue this unsustainable system, it will likely be the sacred cow of the U.S. government for years to come, even with our impending fiscal issues. I would also like to mention at this time Milton Friedman's elegant solution to the problem of entitlement spending. Instead of offering food stamps and health care, Friedman and most other economists suggest what's called a negative income tax, whereby the government just writes an impoverished individual a check for an amount to bring up their income to an acceptable level. They could then use the money at their discretion and make decisions that are best for them, rather than what the government deems appropriate. Under a truly free market system, customers would purchase health insurance like they do life insurance, when they are young, for their whole lives, and at very low premiums. Just like with life insurance, they could keep their plans when they switch jobs, move from state to state, develop a chronic or debilitating disease. Perhaps insurance could be purchased even before birth. It sounds far-fetched, but with high deductible plans and prices of healthcare actually coming down instead of rising, this is not only feasible, but likely.